Welcome to PG Pulse, Press Ganey's podcast on all things healthcare, tech, and human experience. In this podcast, we'll be joined by some of the best and brightest minds in the industry to discuss challenges, share insights, and innovate the future of healthcare. Thanks for tuning in. We hope you enjoy the conversation. Hi, this is Tom Lee. I'm Chief Medical Officer of Press Ganey, and we're talking today with close colleague, someone I consider a friend, and for reasons which I think will become apparent shortly, someone I consider a hero. Is Jon Gleason, the Chief Clinical Officer at Prisma Health. I have followed his work at Carillion and Jefferson before he came to Prisma a few years ago, and at each step of the way, he has been developing a clinical operating system that has helped standardize work and improve performance in all of the dimensions of care that matter to us: quality, safety, efficiency, workforce resilience. And he's going to talk with us about that today. It's reproducibly yielded improved performance. Jon has worked very hard for his institution. He happily is ready to try to bring that impact to healthcare as a whole. That's why he's ready to share insights about the operating system with us today. But I wanted to start by saying, Jon, I know this work is very important for your organizations, but I know it's important for you personally. And maybe you could talk a little bit about why.
Sure. Thanks, Tom. So I got into healthcare originally inspired by my grandmother, who was a small town nurse. And following her, she worked in emergency rooms, into the emergency room. I just fell in love with healthcare, not just the taking care of patients part of healthcare, but just the team mentality with clinicians. And so always wanted to be a physician. And as I got into healthcare, what really jumped off the page to me is that the healthcare workforce that we love so much is operating in disconnected and fragmented models, and it is both harmful to them and also the patients. And so that's fundamentally the problem that I've been working on for the last 10 years, is I believe that the issues are not really about the people. They're amazing. And the tools that we have are also great. It is how do we integrate these wonderful people with wonderful tools? And the answer to that for me has been systems, building great systems for people that enable them to produce incredible outcomes. And so from my perspective, that's one of the core responsibilities of executive leadership, is to provide not just tools and the right cultural framework, but to really fully integrate those things into one clear, simple operating model. And so that's what I've been up to. And it's really been about just making sure that our teams have what they need to take care of patients and that they're enjoying it. They have bandwidth to enjoy it as well. The second motivation for me is that I have a young son who has disabilities, and he's my happiest kid. And, for people like him, care is just not designed for them. And so one of my passions is about how do we design care that's wonderful, safe, and accessible for people that don't have typical abilities. Well, that's quite an effort to do that. And healthcare organizations need to have bandwidth and to be able to do that. And so that's another one of my motivations, is if we, from a systems-based perspective, can put our teams in a place where they're loving what they're doing, they have what they need in order to produce great outcomes for the patients have what they need as well. That frees us up to have bandwidth to do all kinds of things that we should be doing that we just don't have time to do right now. So those are the two main things.
Well, I know you well enough to know that, intellectually, you're driven by, it's irrational to you that our healthcare system should be dysfunctional, but it's something beyond irrational. It's intolerable, given the experiences of your son, that we have the dysfunction we do. And I know that that is what gives you the fire. And that's why I've always enjoyed you and appreciated and respected your work so much. Well, let's talk about that, because you and I both, we grew up as clinicians, and right. The idea of making care better with the teams that we're working on. That's hard work and it's great work, but it's a little bit more straightforward than trying to make care systematically good across a system with multiple sites and people who don't even see each other every day. How do you approach the work of trying to make systems work like systems?
Yeah, so to me, the one of the critical components of success is the infrastructure that's required to be a great organization so that all of the patients and the team members have what they need is just fundamentally different when you get at scale, right? We have 6,000 members of our provider network. So how do you get them all working together? And, for me, the main thing for us is we have the clinical operating system, which is a single branded tech-enabled management system. It defines all the core workflows of the organization. That simplifies the daily work. It includes a daily problem-solving exercise where, we say we solve 90% of the problems in the company that day. We do. We hit 92% last month. So being able to solve problems is really, really important, number one. Number two is just the transparency that you have to provide to an organization at scale about what you're doing is really, really important. Small organization transparency can be achieved through relationship, right? But at scale, you have to provide that through data and insights. And so for us, we say if you don't know what's going on, it's because you've chosen not to, because we provide all of the insights about how the organization is doing on a daily basis. And overall, from an outcomes perspective, at all times, it's available to everybody from the CEO to the environmental services worker. So that transparency is really important. So solving today's problems today and having really deep transparency in the organization creates the foundation of social capital and trust that is required to do the third thing, which is to enable the teams to put care pathways in place that reproducibly move the needle on health outcomes in the company. So, we've done 142 different care pathways, sepsis care pathways, epilepsy care pathways, breast cancer care pathways. And for all those care pathways, we build all of those systems, so that we can track whether or not we're following the processes that we think are right for those patients and all the outcomes, and everybody can see it. And so establishing that foundation of trust by solving the needs of the day, by providing that transparency, gives you what you need to then move forward and do massive care transformation at scale. Of course, there's a lot of infrastructure that's required to do that, and that's really what COS is. It's that infrastructure that enables us to operate at scale. So I think those are the key things.
Well, all right. So as a longtime physician, I have just sort of worked hard, and I thought that was the answer to everything. I really don't have any idea what a clinical operating system means. Like, what is it?
So the clinical operating system is really comprised of two things. There is a management system that defines the daily work of the organization. So, and that management system is an integrated management system of safety management, quality management, efficiency management, patient experience management, and team engagement management. So hang with me for a second. In many organizations, you might have a set of huddles and rounding that happens around safety. You have a set of tools that people use to manage safety. They may have a separate brand around how they manage safety as an organization. And your frontline team, they have to go to a meeting about safety. Now, there's also a management system around efficiency. There's a different set of tools. There may be a different set of rounding, a different set of priorities and goals, and set of meetings about how you manage efficiency. Team engagement, same thing. There may be team engagement, huddles, rounding, coaching, and tools. And all of these things are operating in parallel. That is, to me, just one of the core problems with how we build healthcare. And what COS is, Tom, is it is an integration of all those workflows into one thing, one set of workflows. And so there's one type of rounding, there's one type of huddling, there's one place to go to have insights, there's one place to go to tell the organization how we can get better. So rather than 5 systems operating in parallel, it's one system that's happening. And so because you've done that, you've actually created a lot of bandwidth in the organization in order to do that work, right? So they're not having to make trade-offs. So for us, we have a specific time during the day where it's set aside for those team members to do that. We don't ask them to do other things during that time. Why? Because they're doing that one tech-enabled set of workflows that's happening within one branded system. So that is one of the key components of COS. It's simply an integration of what is in most health companies, parallel and competing workflows. And that's it. And so what that does, when you do that, it creates so much bandwidth for people to do the work, to enjoy the work, and it also creates bandwidth to do like what we talked about earlier, which is to take on things like, how are we taking care of people that don't have typical abilities? How are we taking care of heart failure at scale? How are we taking care of heart failure for people that don't have typical abilities? Things that health systems typically don't ever get around to because they're working on all of the chaotic and competing efficiency, management, experience, safety, and quality systems that they're dealing with.
Listening to you, I realized that probably most of our managers and clinicians are like reinventing the wheel every single day, as opposed to having an idea of what the wheel is and just using it. My understanding is that you have designed this clinical operating system, not just thinking about the organization, but thinking about a manager. It's like a patient-centered care. This is management-centered operating system. And I think you, as I understand it, you even have a name for this person, and you're picturing. So can you elaborate?
Right. Well,
who is that person?
Well, Sarah. We call her Sarah.
That's what I've heard.
And so in our organization, Sarah is famous, and so what I think one of my core responsibilities is making sure that Sarah has what she needs and an unbelievable experience of giving care. And so that's part of why we have branded the management system and the tech-enabled management system and put it all together in one place. It creates a different experience for her. What we have shown in our organization, again, we solve today's problem today. If you don't know what's going on, it's because you've chosen not to. And the impact that we have with all of our care pathways, it creates a sense of pride in the organization about what we're doing, and our team members really lean in. So let me tell you a story. We have a nurse in our organization. Her name is Ashley Smith, and she recently was awarded the Daisy Foundation IHI Global Nursing Safety Award. Mm-hmm. And the reason for that is because she works at one of our smaller facilities. She used our clinical operating system to make the whole organization better 63 ways in 1 year. So what does that mean for Ashley? She comes to work every day and she takes care of her patients, but she also has the opportunity to have an enterprise-wide impact. Mm-hmm. And so it is that sort of unleashing in a systematic and efficient way the luminaries that work in your organization that really changes it.
Yeah.
And so, that when you do that, it really changes the organization, the dynamic nature of the organization. And so that's just a key part of what COS does it gives everybody an opportunity to paint on one canvas. So Tom, we talk about in many organizations, you might have one set of tools, right? Data tools, improvement tools, workflow type tools. And you might have the same set of goals, but everybody is an artist painting on their own canvas, using your tools to achieve the same goals, but they're doing it a little bit differently. Mm-hmm. And so for us, the idea is that you can be an artist in our organization, but like Ashley Smith, mm-hmm. you're an artist painting on one large canvas.
Yeah.
And so, and that really does change the organization. The second thing I would say is that we talk about convergent improvement versus divergent improvement. So divergent improvement is one set of tools in the organization and an improvement methodology, one set of goals, get the right leaders in place and say, go achieve these goals with all these tools. And everybody, 4 North has one way, and then 9 South has another way. and maybe they talk a little bit, so they're kind of learning from each other, but they're basically doing this different things with the same tools.
Yeah.
That is divergent improvement.
Yeah.
Convergent improvement is COS. We're all working together to establish that one way. And one of the things that I've learned in this process, a decade in doing this, is that one of the key success factors is having the wisdom to know what can be systematic and what needs to be left to the teams for that autonomy that they need. Because there's some things that you can't make systematic.
Yeah.
And so that's one of the key success factors, is having the wisdom of understanding what are the things that just have to happen every day and you can systemize, and then the other things that really the teams really need to be able to determine for themselves.
Yeah, well, you anticipated my next question, which is that tension between autonomy and standardization. And my clearly, you know, we have to preserve some autonomy. You have to actually give some people the chance to feel like they can be an artist. But how have you learned how to deal with that tension? Like, are there instances where you went too far in trying to standardize things, or you didn't go far enough? How do you manage that tension, which is such a hard one for system leaders?
Yeah, so a couple things. One is how we think about and talk about the work. We don't use the term standardized very much because we see patients. You and I are both seeing patients, and nothing about it feels standard when you're taking care of an individual patient, right? And so we talk about optimization. We talk about making sure that the patients get what they need. So there's a language I think that's important, and there's language that gets in the way. And that language around standardization can kind of get in the way. So I'd say that's one thing. The second thing is, again, if you're going to ask people to convene and develop a way that we treat strokes, as an example, clinicians are brilliant, wonderful luminaries. The people that we work with are truly amazing, right? We know this. And so they have to understand the impact of them doing that. So they design the care pathway. They should be able to see the adherence to that care pathway clearly, their own and everybody else's, and they need to be able to see the corresponding outcomes. If you're just saying, oh, trust me, it's evidence-based care, but you're not showing them the outcomes in any efficient, really sort of transparent way, it just doesn't work. You have to give them that level of insight into what's happening. So that, I think that is, you just must do. Any idea around optimizing when people can't see the impact of both the process and the corresponding outcomes, it just doesn't work. It falls apart at some point. And then I think the last thing that I would say is wisdom about what it is that you're trying to develop care pathways on. So, we treat thousands and thousands of different things, Tom. There are some things that we treat where there's very clear evidence-based practices that are out there. The evidence is solid. You should give oxygen to a patient who is having a heart attack, cardiologist, okay? And so that's not debatable. It's just clearly the case. And so, what I tell our folks is, look, even in a best case scenario, let's say we've developed care pathways around all of the things where there's really solid evidence. At best, we're at half of the different things that we treat as clinicians. So as we create these care pathways, we're just giving you bandwidth to really focus on that 50% where there isn't a clear care pathway that's needed. And sort of related to that, as we, as an example, developed a heart failure care pathway that travels with the patients across the whole care continuum, and we track adherence to that care pathway and the corresponding outcomes. Our adherence to that care pathway is somewhere around 70%, 60 to 70%. The right answer isn't 100% because some patients have, they may have autoimmune disorders or other things that are going on, and it's just not appropriate for them to be on that care pathway. And so again, not being reductionist, not talking about just standardization, but we're optimizing. For those patients where there's clear evidence-based practice, we're just going to do the right thing. It gives us bandwidth to take care of these patients that are the puzzles, right? The ones that we really think about. And so it's just about creating bandwidth. So I think those are some of the key insights.
Well, I won't make you brag about the performance at Prisma, but I'll just summarize it for the audience that within 18 months, there was remarkable improvement on all the types of performance that matter, patient experience, safety, efficiency, workforce resilience. It's great performance. I just want to wrap up by asking you about advice you would give younger people. I still consider you a pretty young, but I would say that you have you've had tremendous impact already on your organizations. I think the operating system is going to have tremendous impact on healthcare on a much wider scale. We haven't talked about it in this podcast as a focus, but the work that you've done for people with disabilities is a whole nother great story that where you've had a lot of impact. I'd ask, if you were the young Jon Gleason, coming out of your training today, looking at the challenges that we face in healthcare today and society at large, what advice would you give a young Jon Gleason today?
So I think early in my career in leadership, my motivation was, I'm going to say 100% for the patients. It's all about the patients and making sure that they have what they need, that they're safe, that they have great high quality care, that there's access to care. And as my journey has gone on, that is still the case. What has emerged for me, though, is that I'm also 100% for the team. And I was always that way, but that mindset is so important, is that in order to save the patients, you have to save the team. You have to provide for them what they need, the social capital. They have to have a foundation of trust, which means they have to know what's going on. They have to have agency to make the organization better. And so, my perspective has matured to where I understand that the way that I impact the patients, I'm 100% for them, is all about the team. And so I would just suggest that that is one of the key success factors, is the healthcare workforce is amazing.
Yeah.
Say that.
Yeah.
Live in that. Think of yourself as the enabler. The second thing I would say is that once you get into executive leadership roles, the key is being accountable for the systems of care and fully accountable. So, tell you a quick story. I came to Prisma. I'm in my 5th year there, and it was January of 2022. Of course, walked around, saw the whole organization, walked through, 15 hospitals, met thousands of people. And at that point in the organization, effect of the pandemic, patient experience was in a bad place, and mortality and sepsis mortality, team engagement, financials wasn't like a lot of good news in healthcare at that point. And so I came back to the organization after my 30-day tour.
Yeah.
And I said to them, look, I've been across this whole organization, and I can tell you that the people are amazing. Wonderful nurses and doctors, incredible people, and yet our outcomes aren't where they need to be. And so the only possible problem is that the systems of care aren't what they should be. We're asking you to do too much. We're asking you to deal with an efficiency system, a safety system, a quality system, an experience system, and all these things. And we need to build you a better system. I'm responsible for the system. Yeah. And so effective now, I'm the problem. And if we'll work together, we can build a system that's really going to be amazing for our people, and our patients will benefit. So that just accountability, the responsibility, and just owning the systems of care, right? That I think is one of the key things that I would tell myself at that point.
Well, that actually gives real clarity, which, frankly, I didn't have before. I would now tell younger people, learn to be an excellent clinician, on an individual basis, but then learn to build great teams, and then learn to build great systems. And that's a pretty good career, one to be proud of.
Yeah.
Well, look, the work is great. I've enjoyed every step of it along the way. I'm thrilled about what lies ahead, and I'm thrilled about the idea of working with you directly, writing with you directly, and doing our best to make healthcare better for your son and for everyone else who needs our help.
Thanks, Tom.
That's a wrap. Thank you for joining us today, and special thanks to our guests for sharing their time and insights. Stay tuned for our next episode, which will be released soon. In the meantime, visit our website where you'll find more information on the human experience and a lot more.